over to my colleague, Lisa.
Thanks, Megan. Hi, everybody. My name is Lisa, and I'm really happy to be here today. I am with the Social and Structural Vulnerabilities program as well as the research manager. Megan, if you could forward the slide for me. So just to begin, I want to acknowledge that we're on the traditional territory of the people of Treaty 7. This includes the Blackfoot Confederacy, including Siksika, Piikani, and the Kainai First Nations, as well as Tsuut'ina First Nation, Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nation. And the city of Calgary is also home to the Métis Nation of Alberta Region 3. I also just want to acknowledge as well the harms of colonization and how colonization historically and currently continues to impact people and populations who have been excluded and underrepresented. And part of the work that we do at SSV is really to try to build authentic health equity for all groups, people, and populations. So I thought it was important to also acknowledge that as well. Okay, so just a little bit of an overview of what we're going to talk about today. I'll give you a quick overview of the SSV Research to Action Social Hub, how we approach community research focused on impact. Then we're going to have Candace and Ash give 2 examples of their projects exploring challenges to impacts upon policy and practice in community. And then finally, we're hoping to have an interactive discussion through the Q&A or the chat function around impact strategies and pathways to impact. Okay, so what is SSV? It is a research to action social hub that was launched in 2021 in response to the O'Brien Institute's priority on social and structural vulnerability research that was first identified in 2017 as a research priority. So Dr. Katrina Mullaney is the lead. Dr. Megan Edwards is the lead on education and community capacity. Rick Sardea has recently joined us as an amazing project coordinator. And then I look after the research. So why does this hub exist? It's to generate and mobilize research on populations who are socially and structurally vulnerable. We try really hard to find innovative solutions or advance innovative solutions for systems change and really translate evidence into impact. Also, we really value and try to develop future leaders in this area by crafting roles for both students and trainees in the community. And we do this by having them participate in the research and social action and projects right on the ground within the community. So how do we do all of this? I believe that the cornerstone of all of this is actually collaboration with community. So every single project we do is built on collaboration, co-design, co-development. We build really strong relationships in the community and we have strong working partnerships. Some of the research projects that we have on the go right now and the sectors that we're working with include homelessness, mental health and addictions, domestic violence, disability. We're working on a social network analysis of our community engagement relationships, and Megan will be speaking to that a little bit later on. And we also work with policies and have relationships and projects going on at both municipal and provincial levels of government. Some highlight just a couple of projects that we're working on at the moment. We have a national youth diversion homelessness study. This is taking place across 6 different cities in Canada. It's a 3-year funded project, and it's all being led and guided by the 6 community agencies, youth with lived experience. We have Indigenous engagement committees and youth engagement committees that are sort of showing us how to do this work rather than us deciding how it needs to be done. we're getting guidance from them. And similarly, we are working on a culturally safe housing program for Indigenous peoples. And this work is absolutely being driven by Indigenous people. We're working with the Aboriginal Standing Committee on housing and homelessness. There's different Indigenous organizations that are part of that committee. AHS is part of that committee. And again, there have been multiple engagement sessions with knowledge keepers, elders, Treaty 7, housing providers, and it is a very collaborative project that is being guided and led by Indigenous people themselves. Priorities have been identified by them, and so we listen to what they say and go forward on that. So yeah, just how we do this all, just to sum it up, it's the collaboration piece of it that's the most important, I think.
And Lisa, can you say a little bit, sorry to put you on the spot, could you say something a little bit about the output, like how, where it's of the culturally safe housing project and how it's a bit more than just doing the peer-reviewed journal article piece?
Sure, I think, yeah, so I mean, part of what we're doing is hopefully trying to create a partnership and a network across Calgary, Alberta, and hopefully it will go further than that. And it's actually not about creating a publication at all. It's about bringing different people to the table to talk about, how are Indigenous peoples experiencing racism and discrimination when trying to rent. And it's bringing those people with lived experience, landlords, health inspectors, property managers, all together to try and find ways to have impact, really, to have impact on those who are actually affected by the racism and discrimination. It's a really exciting project. It will obviously take a lot of time and continued engagement with elders and knowledge keepers, but it's that collaboration piece that will lead to the outputs for the program. Thanks, Megan.
Thank you. I'm going to talk a little bit about our student projects, because traditionally, I think we don't imagine student research having long-lasting impact, but we are, one of the things we do at the Hub is imagine impactful roles and collaborative roles for students in the community. And a separate project that I've been doing under the Hub, looking at students' experiences in the community and community partners' experiences working with students. There's some themes have been revealed, looking at how to create pathways to impact with student projects. So the best practices seem to be to make multi-year projects that don't just end when the student is finished. The projects should be based on community need, but also be reciprocal. So the students are learning and the community is gaining something. And that's from the get-go, right from the start, seems to be the important thing, rather than developing a project and then taking it to find a community partner. And the projects need to be designed really with built-in formal and informal support for students working in that space. They need lots of wraparound support to make sure that things go well in the community, and to learn about building relationships and sustained relationships over time. So I have asked two former students who have gone on to great success and continue to impress me all the time, two students that I supervised at the School of Public Policy. First, we have Ash, and he's going to be explaining his project that he did when he did his capstone, really examining some of the pathways to policy impact. Really interesting participatory ideas. And then Candace will present her the current work that we're still engaged in despite her graduating a while ago, where we're translating and mobilizing some of the results of the research that she did for her capstone project. So Ash, if you're ready, you can take it away.
Thank you for the warm welcome, Megan. I'm Ash Seth, and I'm working as a researcher at the School of Public Policy, University of Calgary, and I'll start sharing. All right. Today I'm going to talk about a research study which aimed at identifying approaches through which decision makers could best engage with community organizations to design pandemic response policies for persons with disabilities in a participatory manner. Here we have used the term co-design for participatory policymaking, as we'll go ahead. A population of interest for this project were key decision makers from the government of Alberta and advisory councils. We recruited around 12 participants from relevant government ministries in Alberta, along with federal and Albertan disability advisory groups. We conducted semi-structured qualitative interviews with the participants between June and July 2020. The interviews involved open-ended, semi-structured questions, and there were probes on aspects like barriers and facilitators to engagement. What are some preferred co-design approaches and preferred aspects of co-designing during the COVID-19 pandemic? The interviews were transcribed word by word by using NVivo, a data analysis software. And rigor in the research was established by seeking principal investigator and co-investigators' input at different stages. The results from our interview enabled us to understand the main barriers and facilitators to engagement between community organizations and governments. To begin, participants indicated accessibility and navigation as the topmost barrier, preventing community organizations full engagement in co-designing policies. Participants mentioned that traditional engagement approaches such as community consultations or surveys are usually devoid of inclusive elements such as accessible buildings, access to special transport for medically fragile individuals, and inclusion of consultation tools and easy to understand languages. The power imbalance was another major impediment to an optimal co-design process. Many participants believed that the dominant voices, particularly from prominent organizations and self-advocates, frequently appear in the engagement sessions, whereas small community organizations are left behind. We also found that the tokenistic ways of engagement were a significant barrier. Participants said that although governments had actively solicited stakeholder feedback during the pandemic, but there was a gap in communicating whether the input has been accepted and how it shapes policies or guidelines. To address the engagement barriers, participants highlighted several promising approaches. They spoke of need for having accessible consultation to overcome engagement barriers. They mentioned improving the accessibility of venues, including presence of ramps, sign language interpreters, closed captioning for presentations, and use of plain language, that is simple language, for disseminating information. Most participants mentioned that the significance of engaging community organizations in developing and reviewing pandemic communication plans while building their capacity is critical. Every participant viewed the development of a multi-stakeholder social policy hub, which we are talking about today, as a value proposition. They believe that the persons with disabilities and representative community organizations could bring in experiential lenses, whereas academia could consciously bring a scientific lens. The research found that including community organizations and communicating pandemic information in easy to understand way, that is plain language, was the preferred co-design approach. Participants suggested that community organizations could also play an educational role in disseminating information regarding pandemic protocols and understanding persons with disabilities' concerns about the pandemic response plans. And in addition, community organizations could also be involved in reviewing pandemic plans and help the government tweak the plans. The results also helped us to understand how governments prefer community organizations to solicit them for consultation. Participants from governmental ministries recommended that community organizations approach governments respectfully and collectively to find common priorities. They also suggested that the organization propose solutions rather than echoing issues regarding the pandemic response plans. May I take this opportunity to share some firsthand experiences about the organization's engagement? A provincial government participant mentioned that community organizations must be categorically included in the consultation process of pandemic response plans as their community's eyes and ears. Another federal advisory group participant said that governments could play a significant role in contracting disability groups to design and implement pandemic messaging and acknowledging their expertise. We are confident that the findings from our study will provide critical insights for disability-inclusive recovery policies and programs that integrate the needs of persons with disabilities for their safe re-entry into the society. Thank you for your attention, and I hope you enjoy the rest of the event.
Thank you so much, Ash. And importantly, I'd like to point out that at the time when Ash was doing his capstone, he was working collaboratively with our community partners, self-advocates and disabled persons organizations and other groups, especially under the Alberta Ability Network, who are an essential community partner to the hub. And yeah, that was a very important findings that we could disseminate amongst our community partners. And Candace, if you're ready, I think you can go. Thanks, Ash.
I'm definitely ready. I apologize for having my camera off. It seems as though this helps the glitching. So I'll just go ahead and share my screen and I'll get started. Okay, great. So first of all, thank you for the introduction. I'm very happy to be here today over this lunch hour to discuss knowledge mobilization and to also share my experience with building research relationships and partnerships. And more specifically, I'm looking forward to discussing the 3 steps that myself and fellow researchers have taken to build and maintain those relationships, which are partnering with the community, meaningfully engaging with the community, and then mobilizing that knowledge to maintain the relationships. So the first step in building my community-led capstone project actually began before I took a seat at the table, and that was with my predecessors, which one of them was Ash, and then of course my supervisors who partnered with a task force, which was called the Reentry Strategy for Persons with Disabilities, and that was back in May of 2020. So this task force was a collaborative effort, and it was between community stakeholders, agency partners, and of course those academics who were focused on addressing the COVID-19 challenges that were faced by Albertans with disabilities. So the task force ended up completing a multi-jurisdictional environmental scan of the best practices to address those challenges and identified the sort of overarching priorities that actually became the foundation to shape my capstone project. And my relationship with the task force began in November of 2021, and working closely with them as well as with Dr. Edwards as my supervisor, our aim was to gain in-depth insights into how persons with disabilities and their primary care providers were impacted by the pandemic. So we created a survey featuring questions that aligned with the task force priorities and was focused on better understanding those challenges. And our hope was really that the results would create sort of a pathway to address those challenges through the creation of tools and policy-focused recommendations. So the second step of building the community-led research relationships in the context of this capstone project that I did was centered on ensuring that we meaningfully engaged with persons with disabilities, their families, as well as organizations to bring all of those lived experiences to the forefront. And this aspect of building relationships really does align with the ideology of participatory action research, or PAR. And that was chosen as the approach to this research because it emphasizes participation and action, of course, by members of the communities that are affected by that research. And so what we found was that working with different disability groups helped to strengthen the project's alignment with that ideology, and also with the research initiatives that were truly rooted in the priorities of the actual disability communities. So we partnered with self-advocates for the plain language and overall accessible design of the survey. And then we also meaningfully engaged with disability organizations. We partnered with the Alberta Ability Network, which is the network that Dr. Edwards had just mentioned, which is really an umbrella network that has connections to key stakeholders across urban and rural Alberta. And they were really instrumental in the dissemination of the survey. They shared it with their contacts and even on social media platforms. And without those connections, I truly don't believe that we would have had the 170 survey respondents that we ended up having. So the final step was to share what we heard with the community. We typically shared the main findings from the survey, which were that 20% of the respondents noted a decrease in their income, 59% experienced a decline in their mental health, 41% felt that they did not have enough information about the COVID-19 vaccine, and that really sort of resonates with a lot of what Ash was talking about, and 35% found it difficult to wear masks, and then finally 57% of those respondents preferred in-person service delivery. So when it comes to sharing this information, Dr. Edwards and I had a chance to sit down and talk about the lack of capacity to continue to mobilize these findings. And although the capstone project is complete and I've graduated and now work as a policy analyst for the government, Megan and the executive director from the Alberta Ability Network and I have really remained focused on continuing this work. We've kept this project really kind of on the side of our desks for two main reasons from my point of view. And one is because I think we feel that, we're accountable to the community to share what has been discovered. And two, we do think that there's a lot of value in gathering the feedback around how the findings resonated with the folks who took the survey, and also how the community is dealing with COVID-19 1 year later after the survey. And then very importantly, and something that I think is key to this, is we really do want to know what the community would like to see done with these findings. So to achieve some of these things, we've put that feedback into action by continuing our partnerships with some of the task force members, the Alberta Ability Network, and self-advocate groups. And on the evenings and weekends, we've held sessions, information sessions with disability organizations and, of course, persons with lived experience. We've created a summary report that is also being put into plain language, as well as a plain language infographic that provides a nice high-level visualization of the findings. And lastly, we're continuing this work by building out a communique that will be targeted at the government of Alberta and will feature not only those findings, but some policy recommendations and next steps and considerations for future pandemic planning. And really, that's it from me today. Thank you so much. I'll hand it back over to Megan.
Thank you so much, Candace. Alan has asked a question around specifically some of the results that we found. Some folks labeled with intellectual disabilities have talked about how the pandemic felt like institutional times, not being able to leave the house, masked and distant staff. Is that something that you've encountered? Yes, in our conversations with people and folks in the community, certainly, I don't know if I've heard anyone point out exactly it's like being in an institution again, but it's been that experience for people many times. It's similar to that type of experience, and it's been extremely isolating for sure. Candace, did you hear anything about people comparing it to institutional times? It makes so much sense to me.
That does resonate with me as well. And I think we haven't heard that specific comment, but we have heard comments that are similar. And that social isolation piece is one that we keep hearing over and over again. And I think, that was really reflected in our survey findings as well, seeing that 59% of those 170 respondents did say that they felt a mental health decline during that time. And it is something that is still resonating with the folks that we've been chatting with more recently as well. So, yeah.
Yeah, exactly. Thank you. Yeah, I think that thinking about Candace's work specifically and Ash's as well, it's really important for us to acknowledge the importance of grounding that work in reality on the ground. What community agencies are and self-advocates, disabled folks are experiencing. And we work hard to do that. We work hard to, first of all, design our projects in such a way that they're responsive to and meaningful to the community. And we also certainly use those strategies when we mobilize and translate the knowledge that we've collected. And we see our responsibility extending to that impact piece beyond just a publication. While also important, we see other areas that we need to make sure to close the loop on when we're finishing up projects. Yeah, this is an excellent question, Alan, around collaborative publications with persons with disabilities, and certainly with disabled people have had in some very exclusionary experiences with this when it comes to publications. I know that you've got some experience there as well, and certainly being even named can be an issue when people are co-researchers. Oftentimes it's just like the disabled co-researchers. I've heard that mentioned in several different areas. It's something that we have to really be working on. I wanted to mention, Lisa alluded earlier to our social network analysis, which is an ongoing project that I've been doing for a few years now, trying to find the best ways to sort of map who is working with whom in the community and with what faculties and the nature of those relationships. And to various degrees, it's been tricky making sure that we're getting all of the community partners that would like to join. They're hearing about the survey and able to fill it out. But interestingly, the qualitative information from the survey, which I never really put that much weight on usually because people don't generally type that much on a survey. I was thinking the quantitative stuff would be more useful, but the qualitative information from the survey has ended up being extremely interesting. And we've got 18 or 19 now surveys filled out and in quite a lot of depth. And so I'd like to just share a few things from that. Really looking at how our community relationships work towards impact or not. So, 18 agencies. As of last night, I should have changed the slide, we had 20. So we've got them from across a range of social issues and marginalizing and racialized communities, lots of community partners here around disability services, Indigenous supports, homelessness, LGBTQ2S+ support, poverty reduction. So a lot of variety. These groups tended to be working with community health sciences, that's us, Cummings School of Medicine more generally, School of Nursing, School of Education, social work, and architecture, planning, and landscape as well. Why were they working with UCalgary? I organized the qualitative information into some preliminary themes. So this is still very preliminary. The first being for organizational or practical need, they need to evaluate some programs, they need to acquire funding, or they can't do the work they want to do because they can't get funding on their own. So they need to partner with UCalgary. Oftentimes relational or personal contact. So they know the researcher, they trust the researcher, they believe in the work that this person or persons are doing, so they seek them out or agree to work together. And then systems change, looking to affect policy, looking to make positive social change, looking to create more social justice, really, and increase supports. And some of the key characteristics that are emerging, these are, again, very preliminary themes. Some of the characteristics of successful, impactful research relationships are a participatory model and a mutual respect for expertise. So that means an involvement in all areas of the design of the project, listening to one another's ideas and responding to those ideas and changing course if necessary. And then open communication and trust. Trust was very commonly used word when people were talking about positive relationships with the university. So that means delivering on deadlines, delivering on promises, working together meaningfully over a longer period of time, and meeting regularly. And then a focus on impact. So that means that researchers are assisting in policy work and advocacy at times, or delivering on outputs that assist the organization in having some kind of impact that they were really looking to enact. And some of the less successful research relationships, or ones that maybe had a bit less impact, they were less participatory. A very common response to this was the UCalgary researchers tend to choose the questions with limited input or quite strict boundaries, and not really reflecting some curiosities or needs in the community, and designing questions that serve the academic. A lack of knowledge of reality on the ground, not understanding time constraints, not understanding suitable methodologies or appropriate ways of contacting participants, for example, or interviewing people. And breakdowns in communication, so that means infrequent meetings, lack of updates, especially once a project is completed, and a lack of follow through. Nothing surprising here, but interesting nonetheless. And here is, I think, an important quote from a community partner. Don't usually like to read this word for word, but I think it's just a very good quote. It's important for the university to work with existing and leverage local research more effectively. This is something we've all learned in working together. Often research after the accolades sits on a dusty shelf. However, our committee takes the recommendations seriously and puts this work into practice to leverage this work more effectively. And I think academic research is important. However, using it effectively in community is how it creates change. So it's been our experience thus far, and we really are examining these pathways and really trying to uncover some of the specific ways in which we can ensure that our research has impact. But it's been our experience thus far that significant dedicated time to relationship building is necessary, and collaborative knowledge mobilization with more accountability on the side of faculty members or researchers is essential. And I think that could mean building this more meaningfully into ethics applications. I know it's there in a sense already and in funding applications, but really being very detailed and creating a lot of accountability around how are you going to ensure that this information is translated back? How are you going to ensure that it has the impact that you've promised? A recognition of the value of collaborative research for social change in comparison with other types of knowledge and evidence production. And that's a systemic issue, really, and beyond. because there is a sense at times that research that is grounded in the community is somehow less than or different to evidence that's created in other ways. And I think that that's importantly linked to this idea of cognitive justice and different ways of knowing. So that means really opening up the world of knowledge production and evidence to different ways of understanding that and different ways of being in the world. And I think we're all starting to move towards that at the university, trying to think about decolonizing some of our ways of carrying out our work. And maybe a recognition of the commitment that it takes to carry out this work, of the length of time, and really the dedication that it takes. I think a recognition of that in tenure and promotion guidelines systemically would be great. Luckily for me, I'm an instructor, and it's less necessary for me to be in that funding cycle, get more grants very, very quickly, and just having to publish in peer-reviewed journals, and then having that be the only output that people are really looking for. And luckily, I have a department head who makes space in my role for me to do lots of community research and translation of the research that we do through supervision of students, and really valuing that work. So that's the lucky part. So shout out to Fiona for that one. We would like to have an interactive discussion with folks if you're interested. We have about 20 minutes left. And we would sort of like to throw this back to you around the ways that we can ensure that our research has impact. Lisa, did you want to go ahead?
Yeah, I think the first question that we just wanted to pose to everybody, like Megan said, if you're open and willing to kind of share your experiences with sort of community engaged research, what are the challenges you've experienced? You can raise your hand, you can type it in the chat, you can use the Q&A button. Yeah, so we'll start with that one. What are the challenges maybe you've experienced in this type of work?
I'd like to also point out that I know at least one of our community partners is here, and I'd like to also welcome them to say anything too. You're certainly welcome to join in this conversation as well around challenges working with us or working together. Thank you, Nancy. The infrastructure to support continuing engagement with community partners. Yeah, exactly. And if anyone would like to raise their hand, we can unmute you as well if you'd like to say a little more about that, Nancy, or anyone else.
I appreciate that comment, Nancy, because I was talking to one of our community partners about that actually, and we do, and it was kind of what Candace was talking about too. We do the research, and then that's it. The research is done. The project is done. We give the results to the community agency, and that's it. And he was telling me that that needs to change. There needs to be that ongoing engagement to ensure that the priorities that were identified by the community agency in the first place, that we're supporting them throughout that entire process, not just for the length of funding or not just to get a publication. Like, it really needs to be not lifelong, but it needs to, like, the relationships need to continue to be there. And I think that's extremely important.
Thank you. Also, I'd like to just kind of point out another thing that I'm not sure if I emphasized enough, but Candace is still working very hard on this project, this in mobilizing our knowledge. And as I said, she graduated some time ago and is working full time for the government at the moment. And she is also doing this, but there isn't really a way that's clear to me for us to incentivize this kind of work. How do we encourage students who graduated to keep it up and to keep connected to the projects that they have committed to? Yeah, it's another thing to think about. And Alan mentioned, thanks Alan, some scholars still believe community-based work. Yeah, it's less credible and less rigorous. It's certainly very true. And we definitely need to change our ideas around knowledge co-creation. Absolutely. It's just, you know, we really need to open up that ivory tower. Absolutely. I know that many people for many years now have been working on this problem. But I've been reading a lot of critiques lately of community research where people involved in community research who have done fantastic work in this field are tend to do most of their work around the processes of research. So the importance and the justice of including people as co-researchers, such an important area, but maybe less focused on the outputs, outcomes, or impact from that research, and more focused on the areas of co-design and participatory stuff. And both of those, I think, need to be really important.
I just want to add something here, Megan. So at the School of Public Policy, we are engaged in understanding mental health impacts on persons with disabilities during COVID-19 and what are their experiences for when it comes to access to services during the pandemic, before and prior. And one thing that we have seen, that creating a facilitative environment when we define our research question, creating a very thoughtful environment where we have people with lived experiences in advisory committees and organization representatives, and doing back and forth brainstorming. Okay, this is what we are defining. All right, here are the ways we are conducting research interviews or quantitative studies, and going to them and asking them based on their experiences and research experiences as well as ground experiences, taking that input and integrating it, rather than going through the structured academic process here. And, just kind of taking cues for them and redefining your project with each and every stage. That's really helpful for us, because sometimes we think about input from a very research-oriented viewpoint. Okay, what should be the outcome here? What should be the theme here? But things really change well. For example, we were doing one project where we were interviewing families of persons with neurodevelopmental disabilities, youth, and the advisory council, which comprised of pediatricians, community organization representatives in BC, Alberta, and elsewhere. They said, have you thought about doing research with youth as well? Why don't you get their experiences as well? Which kind of and then there was an emerging need that we must have a person with lived experiences in our advisory council, so that person, or having youth advisory panels who can just kind of guide us through this another sub-project of our research. And then finally, it all comes at the end to the knowledge mobilization, as I think Megan was mentioning, moving away from traditional publication kind of thing, which somewhere lies on your desk after some years, and just being very proactive and tailor-made those knowledge mobilization outputs in terms of policy briefs, in terms of discussions with government officials and policy makers, funding community organizations to attend events, basically. All those things could be further explored by researchers. Thank you.
Thanks, Ash, and I appreciate that you're still really involved in this space. That's great, and you have a lot of knowledge about this. So thank you. I'm glad you got to mention your current project. That's great because it's great work that you're doing. And thank you, Maison, who is our community partner and head of the Alberta Ability Network, and just talking about appreciating the ongoing involvement. Yeah, we were talking, Maison and I were speaking about even just the process of having that feedback, having the results shared, and then hearing the feedback of people and having a chance to even just chat with each other and with us has been really nice experience, I think, for people, and just the opportunity to talk about how they've experienced the pandemic, and how they, just being able to sit at the virtual table with people. And Jesse's asking if universities measure their success in large part by how much funding their scholars bring in. And do you see a path through which universities could shift their criteria for success to include community impact? Yeah, I think that's the key element that we need to really target on a systems level. So, it's a big issue. How can we, I'm not sure which is coming first here, but how can we really have community impact being as important as peer-reviewed journals and high impact journals? I don't know. I think it's a question that we all need to sort of grapple with and to really examine. And I think it takes a lot of work institutionally and beyond to start to dismantle some of these systems of exclusion that we've created, and really systems that I believe create a lack of accountability and breakdowns in relationships and trust over time. I mean, people have been studying relationships between academia and the community for ages, but somehow that last piece of really making sure that we deliver on our promises in a way that it is requires accountability, but also is just sort of built into what's valued about our jobs. That's so important. And Nancy, engagement of citizens in research needs to be recognized as a science that builds the capacity of communities and citizens to co-create, conduct, and disseminate research. Exactly, and partnerships and research need investment and capacity building. And if there's one person who knows about this, it would be Nancy, who spent so many years doing this work and working hard at this very successfully. And Alberta Health's investing in building patient research capacity. Yeah, so there is work being done in this space, and that's certainly very encouraging. Lisa, do you have anything else that you would like to say about that?
Nope.
Okay. All right. Well, how are we? Does anyone else have any questions for us, or would anyone like to respond to any of these other discussion questions that we sort of threw together here? I can't see what time it is because I'm sharing my screen. Okay. So I guess the next piece is for, I think, Lisa, you're going to sort of talk about some of the other projects that we have coming up.
Sure.
Yeah.
Yeah. So this is just kind of an update about what's happening in SSV and where we're going this year. We have our website in development. Roxara is working really hard on that, hopefully to be launched coming up very soon. We've also started doing strategic planning sessions, and this is going to help guide sort of prioritization of different projects in 2022 and beyond. We are planning a community event for Q2 to sort of give a full update and report and brainstorm next steps for both SSV and the Research Hub. And very grateful that we've had a knowledge keeper agree to sort of actually come on board as a member of the research team to support us, working with the Indigenous community in Treaty 7 and sort of guiding us to make sure we're doing ethically and appropriately. And we also have the student volunteers for the hub work is increasing, including we have a student who's been brought on board who's amazing and offering also an Indigenous perspective and Indigenous lens, helping us, as we kind of mentioned earlier, to open minds, open hearts to different ways of knowing and different ways of producing and understanding where knowledge comes from. So there's a lot of exciting things happening. We're always learning and growing and engaging in new relationships and finding ways to always improve on that, what's working, what's not working. And yeah, it's exciting. I'm very excited to be a part of the SSV team. And we really have so much gratitude for everyone that came out today. If you have any questions, comments, suggestions, ideas, please feel free to reach out to myself or Megan. We're always open to chatting more.
Yeah, thanks, Lisa, and thanks everyone for coming, and Ash and Candace for sharing your work again, which I always knock on your doors to do this kind of thing. And yeah, stay tuned everyone as we expand our research into pathways to impact. Thanks so much.
Thank you.
Thank you, Megan.
Thank you.
Thanks, everyone. Have a great afternoon.